This is Victoria Francis Lang and
Amy Hughes.
We are going to discuss the following scenario. A 70-year-old golfer with osteoarthritis complaining of elbow pain.
The most likely mechanism of injury for elbow pain for this scenario is an overuse injury. Khan et al. States that amateur golfers have been shown to experience lateral epicondylitis 5 times more frequently than medial epicondylitis.
There are many factors that are associated with golf injuries. These are technique, the player's grip type, so whether they have an interlocking or non-interlocking grip on the club.
Equipment, whether a golf club bag is too heavy for them to carry or if the club size is correct for the player.
Skill level. Injuries could be linked to the player's handicap or total shots played.
Age of the player. Age can be related to degenerative conditions and it can also affect tendons.
Frequency.
Red flags. NSAIDs. According to Buchner and Khan, NSAIDs can have a negative effect on the healing process of a tendon because they reduce tenocyte proliferation and collagen formation. However, NSAIDs do have a positive short-term effect on pain. Due to the patient's weight and the fact she's using NSAIDs, she could be at a higher risk of developing cardiovascular disease.
Corticosteroids. As she is having it interjected intra-articularly into the knee joint, it will reduce synovial inflammation and catabolic enzymes, which can be related to cartilage breakdown. These steroids also have negative consequences, such as degrading of cartilage matrix and a reduction in elasticity. Elbow pain could be referred pain from the cervical or thoracic spine.
Differential diagnosis. A different pathology it could be is osteoarthritis. Due to the patient already suffering from osteoarthritis in the knee, this elbow pain could be caused by osteoarthritis. Osteoarthritis is a degenerative disease and mainly affects the weight-bearing joints. The signs and symptoms of osteoarthritis are pain and sometimes stiffness in the affected joint, pain that is usually worse when moving the joint and at the end of the day, and there also may be a restriction in range of motion.
Because of her age, gender and weight, and the fact she has pain and swelling makes us think it could be osteoarthritis that is the cause. Very hard and repetitive activity can increase the risk of developing osteoarthritis. Going off her clinical assessment, some of her signs and symptoms also match the symptoms of osteoarthritis. Because the patient has started experiencing pain after having taken up golf, hasn't lost ROM at the joint and has pain on palpation on the extensor carpi radialis brevis and has EMS, this leads us to think it is less likely to be osteoarthritis.
During the subjective assessment, because of the patient's age, she is at a higher risk of developing tendinosis as this is a degenerative condition. We can see from the subjective assessment that the patient has recently taken up golf, which is an increase in training load. However, we don't know the duration of her games or what her handicap is, which would indicate how many shots she was taking in a game. This would give us an indication of how much she is swinging. Early morning stiffness is an indicator of a degenerative tendinopathy due to it being associated with diffuse pain, tenderness, and extension of the elbow, especially in the morning.
Her aggravating factors are playing golf, bending and straightening the arm, and opening door handles. These factors are associated with lateral epicondylitis. Because it's only been a week since her symptoms started, the patient is in the acute inflammatory stage. The aim of this phase is to reduce inflammation and pain, mainly by the use of the police method. Rest and ice help to ease the symptoms. She initially had swelling, which has since subsided. She has taken NSAIDs and has had corticosteroids. So as said previously, these can affect the healing process and affect elasticity.
During the objective assessment, we observe that the patient is overweight, which suggests that she is not very active. Weight can also affect tendon and healing process as well as posture, and this can increase the risk of osteoarthritis. She is weight-bearing more on her right leg due to the ongoing osteoarthritis in the left knee. This could have an effect on her posture and possibly technique when playing golf. She has full active range of motion. She has pain passively during elbow extension. She has pain and apprehension during resisted elbow extension as well as in resisted wrist extension. She scored 4 out of 5 on the Oxford scale, which suggests she has lost some strength in the wrist extensors.
On palpation, she has tenderness on the lateral epicondyle and the extensor carpi radialis. All of these objective measures support the diagnosis of lateral epicondylitis. We carried out 3 special tests to eliminate other pathologies, and only the Cousins test was positive, which helped confirm the diagnosis. We used a dynamometer to measure strength, and the results were that she was weaker in her right hand compared to her left.
Treatment plan. Our clinical impression is that the patient is suffering from lateral epicondylitis. The treatment plan was to include performing manual therapy, such as transverse frictions, soft tissue massage, kinesiology taping to ease the pain, as well as the psychological benefits it holds.
We also decided to prescribe stretches and strengthening exercises. Stretches. The NHS recommends a 10-minute tennis elbow exercise program, which aims to stretch and strengthen the forearm muscles. It includes 1. Wrist extensor stretch, 2. Wrist flexor stretch, 3. Extensor strengthening, 4. Wrist curls, 5. Handshake stretch, 6. Wrist rotation, 7. Sock squeeze, 8. Bicep curls. Please see attached PDF.
Application of kinesiology taping. As long as the patient does not suffer with skin allergies, which according to her clinical assessment she does not, we can apply kinesiology tape to the area. However, we do need to be aware of the fragile skin due to the age of the patient. This will help to alleviate the pain, as it has been shown to help the body's natural response to inflammation, as well as allowing natural joint and muscle range of motion, and it does not restrict motion, as well as the psychological benefits that come along with it.
Potential ultrasound treatment. This has been shown to offer short-term pain relief to the patient and reduce pain over time. The patient would benefit from seeking professional advice regarding a correctly fitted grip for her golf club.
We'd also refer back to her GP and reference her NSAIDs. As stated in the Cook-Purdon model, NSAIDs may be considered in the reactive tendinopathy phase, but not recommended for the disrepair or degenerative phase.
Conclusion. In conclusion, if symptoms are still worsening after 2 weeks of treatment, then we would refer the patient back to her GP, as there is a chance that it could be osteoarthritis and an X-ray could rule this out. However, because of her age, her healing process is likely to be longer due to the degradation of elastic tissue and collagen fibers, which affects the elasticity of the skin. Obesity is also a factor that can affect the healing process because it affects the venous insufficiency, which in turn affects oxygenation and the body's inflammatory response. Therefore, we may need to extend the period to 2 to 3 weeks in the fact that the patient initially had swelling, which had subsided since coming to see us. Could be due to applying ice. However, in the subjective assessment, we did not ask how long the swelling lasted for or how often for how long she was applying the ice for.
A study carried out by a group of physiotherapists states that the use of diagnostic tests for tennis elbow have very little evidence to back them up. However, by aggravating the lateral elbow pain whilst resisting wrist extension and the tenderness over the lateral epicondyle were found to be the more commonly used indicators to diagnose the condition. On the clinical assessment form, we suggested possible ultrasound treatment because of its short-term pain relief. However, as stated in a study by Brooklyn and Khan, patients did not rate their condition as being sufficiently improved after having ultrasound treatment. We could have also cleared the neck to rule out any cervical spine pathologies. This wasn't done on the clinical assessment due to her not complaining of any neck pain. However, referred pain from the cervical spine can be a common cause of lateral elbow pain. If this case was to be presented again, we would clear the neck.